Good afternoon, everyone. Good morning, good evening. Monica, you are the farthest from us. Um, I am Dr. Ratna, and I represent an organization called Dakshama Health. We are based out of New Delhi, and we are a patient organization that works with patient groups. We have an informal coalition called the Indian Alliance of Patient Groups and work across rare diseases, non-communicable diseases, as well as patient safety. Those are our portfolios. Today is the formal launch of Rare Impact 2025. And what we plan to do is to quickly go through what this whole hackathon is about, how it came to be, and why we think that this hackathon probably could find some innovative solutions for families as well as patients with rare diseases. So the hackathon is over 3 months and runs for 6 days, 2 days in November, 2 days in January, and 2 days in February. We officially had an orientation session with country teams this morning. We have 7 countries that are participating. We have the launch now over the next 1 hour, and tomorrow will be a problem and ideation session. So we have 6 problem statements, and each country team will pick one problem, and they will ideate on that to find what are the possible or feasible solutions. Over the next 45 to 50 days, they will work on a workable solution for whichever problem statement they have chosen. In January, they will present their solution to a jury who will do an independent scoring. And based on highest scoring, we will choose a few top ideas that will then be invited to present in person in February ahead of the World Rare Disease Day. And we hope to have a matchmaking session where these ideas will then be pitched against probable investors or government stakeholders or other interested parties who would want to take these solutions forward. So that's in brief about why this to be and how we think that this hackathon could be something very different that we normally do around advocacy for rare diseases. We have 5 speakers from 5 time zones, 5 countries, and 5 organizations. And I've tried to be as accommodating as possible. But we still have Monica, who has kindly agreed to join us, even though she's at a very late hour and is down south in Australia. So thank you, Monica, for joining us. Our 5 speakers will be Alexandra, who will be our first speaker, and she will be speaking about the WHO resolution on rare diseases and its significance for regional and national action plans. She is the CEO of the Rare Disease International. Welcome, Alexandra. Alessandra will be followed by Lara Bloom, who is the president and CEO of the Ehlers-Danlos Society. She's based out of UK, and she has recently taken over the leadership of the International Alliance of Patient Organizations as its president. I'm delighted to welcome you, Lara, to speak about the topic patient-led and patient-delivered, how the hackathon can be a game changer for patient-led innovation. Following Lara, we have our guest speaker, Eric Mansion, who is the Pharma General Manager for Sanofi Southeast Asia and India. And he will be talking about the hackathon as a bold and innovative strategy led by patient groups, bringing in his ideas around how the industry can support such initiatives. And that will then be followed by our keynote speaker, Dr. B.S. Charan, who is the Assistant Director General at the Director General of Health Services, Ministry of Health, Government of India. And he will be speaking about the confluence of digital and health and India leading by example for rare diseases. We've done that in other areas, especially for non-communicable diseases, using various apps as well as digital platforms for mental health, for non-communicable diseases, and how can we use those examples for rare diseases as well. Dr. B.S. Charan will be followed by Monica Fair, who is the Executive Director of APARDO, and she will be talking about regional collaboration and the key to collective action, and how can we transform our learnings at the global stage to something that can be implemented at national and regional levels. So without much ado, I would like to invite Alexandra. Alexandra, the floor is yours. Please speak about your topic, the WHO resolution and its significance for national plans as well as for regional plans. Thank you so much.
Thank you very much, Ratna. I have some slides, so I'm going to share it. I think I can do that, right? Okay. Um,
Yes, please.
okay. I need to allow Zoom to do it. Okay.
Because if you can enable that.
Okay. Should work.
So I will enable.
Let me try again. Yeah, it's working. Okay. Do you see it now? It went too far. Okay. All right, so it's a pleasure for me to participate to this initiative. Thank you, Ratna, for the invitation to represent Rare Diseases International. So you kindly asked me to present the World Health Assembly resolution on rare diseases and its significance for the region and national action plan. So I will talk about this today. I will briefly present Rare Diseases International for those that who may know still RDI, and then I will dive into the WHO resolution on rare disease recently adopted this year, and then explore what is the significance for the region and national level, and what next. Obviously, this will certainly complement very well the presentation from my colleague Monica from Apardo. So about Rare Disease International, before going into details about who we are, I always like to remind a little bit the overall picture of rare diseases. I think we represent more than 300 million people, and just to have an image of what it represents, actually, we are almost as much as people with diabetic, and certainly more than people affected by the HIV. And I think this picture talks by itself. So we are maybe rare, but actually we are we are many. Excuse me. Just to recap few numbers, always to show why our advocacy is very important today. There are still up to 50 patients with rare and complex conditions that remain undiagnosed. There is 70 to 80% of disease that are childhood onset. More than 80% of rare disease are genetic origin. There are more than 6,000, even 7,000. We talk about classified rare disease. And most importantly, patients wait an average of 6 years and see 7 doctors before diagnosis. And there is 84.5% of rare disease that are extremely rare. And finally, there is only 5% of rare disease that have an approved treatment. I'm sure that the audience is very well aware, but I always like to remind those numbers which justify why we are advocating for the recognition of rare disease. The next slide, it's about RDI. So we are the Global Alliance of persons living with a rare disease and their family across all countries and all rare diseases. Our vision, it's a world where persons living with a rare disease and their families experience a better life through full recognition and support. And to achieve that vision, our mission is to be a strong common voice for the person living with rare disease and their family around the world. And we represent more than 300 million people globally. And we are doing it with the main goals, which is to improve equity. And to do that, we, on one hand, empower and engage our members. We also shape the global policy, and this is all about the resolution that I'm going to present you today. And then finally, we also engage in partnership and program to improve access to care. Just a quick overview about who are our members. So at the moment, we are more than 120, represent more than 120 member organizations, active in 150 countries, which cover the 6 continents. And our members are national rare disease alliances, regional alliances, such as APARDO, international federations, such as Ehlers syndrome, actually, organization for ultra-rare diseases, national or regional organization for one rare condition, and other NGOs supporting persons living with a rare disease, such as IAPO. Most importantly, we do not do that on our own. RDI work very closely with many different partners. We are at the moment more than 300 committed partners who invest in time, resources, and expertise. We are notably very much involved, as you know, with the World Health Organization, with the other UN agencies, with the Minister of Health. We also have some private sector members in our alliance of companies. And we work also very closely with hospital and a center of excellence. So overall, it creates an ecosystem that really represents a full range of stakeholders in the rare disease ecosystem. Very briefly, what represents ADI as a unique role, as you may know, we really engage with at global policy level. So we have led the UN resolution in 2021, and then also the recent World Health Assembly resolution this year. We engage directly with the different, as I mentioned, WHO, UN agency, and member state to really shape the global policy ecosystem. And we will be very much involved in the development of the global action plan. I will explain in a minute. And then, most importantly, we also try to create a unified global voice of our community, united in diversity, and which would create a greater impact. And we work very much with different partners. So we create global partnerships to advance sharing knowledge and equity in diagnosis, for example, and other initiatives. Now, the heart of the presentation today, so the World Health Assembly resolution on rare disease. Again, I would like to remind that the reason why we have advocated to have a World Health Assembly resolution is that despite considerable progress, still people living with undiagnosed rare disease and rare disease and their family continue to face significant global challenges. As you know, delay in diagnosis, difficulty in accessing care and treatment, stigmatization, financial burden, and social exclusion. Therefore, we felt that a coordinated health-focused framework at policy level was needed to turn commitment into action and remove those barriers. And so the WHO resolution on rare disease reinforces the need for sustainable and inclusive approach, so no one is left behind, notably in achieving the universal health coverage. And so this hasn't started last year or 2 years ago, but it was more than 10 years of strong advocacy led by Rare Disease International and all its members. So if you remind, already in 2019, rare disease was included for the first time in the political declaration on universal health coverage. In 2021, there was the adoption of the UN resolution on rare disease, so very much broader, not only focusing on health. And in 2023, there was again the recognition that rare disease should be included in the universal health coverage second political declaration. And then in 2025, we advocated, from 2023 actually, we advocated very intensely to get a World Health Assembly resolution. And the difference is that the World Health Assembly resolution really focused on health, set clear targets and deadlines, and create a framework for action for Minister of Health and all stakeholders. Here we are. So in May 2025, the World Health Assembly adopted the resolution called Rare Diseases, a Global Health Priority for Equity and Inclusion. This was initiated by the government of Egypt and Spain and supported by 39 other member states, including India and other countries in the ASEAN region like Malaysia, Thailand, and Philippines. And so there was also at the same time a coalition of members, and the organization HATNA is part of that coalition as well, where we managed to gather now today actually more than 300 organizations, including ADI members, but also beyond, like some academics, some hospital and other organizations, to support the adoption of the resolution. And actually now it's about to support the implementation of the resolution. So if we want to have a better idea of what exactly that resolution aims for, so there is two parts in the resolution. There is a first part, which is about member states are being called to do several actions. This is the first part, and this is here. So notably, Member states are being called to integrate rare diseases into policy and planning, strengthen healthcare systems, so including rare disease into also the healthcare system, improve quality of life for persons living with rare disease and their family, raise awareness, enhance research, and promote equity. So there is already a full range of action that member states can already implement. But most importantly, there is a second part which require the World Health Assembly the World Health Organization Director General to develop, in collaboration with relevant non-governmental organizations and academic institutions, a 10 years global action plan on rare diseases. I put here just an image of what could be a global action plan. This was the global action plan developed for the neurological disorder and epilepsy. And as you can see, there are some strategic priorities like prioritization and governance, diagnosis, treatment and care, promotion and prevention, research innovation, and public health approach to epilepsy, which was for historical reason different. But and part of those priorities, you have then global target. Let's say an example, it could be 75% of countries will have adapted or updated existing national policy, strategy, plan, or framework to include neurological disorder by 2031. So this what could look like the global action plan on rare diseases. And according to the challenges that we are still facing, according to several discussions that we're having with our members, etc., this is the initial kind of strategic priorities that we believe would be critical to be part of that global action plan. Obviously, this is just an indication because the consultation will have to start, and would be led by the World Health Organization, not by RDI. RDI will support the members to provide input to the global action plan, but we are waiting to know the timeline for the consultation. We are still waiting for that. But for example, it could be first priorities, global diagnosis and access to care framework. So to create a clear framework on how to ensure access to diagnosis and access to care. The second could be to standardize this referral pathway and early recognition protocol, which is linked to diagnosis. Integration to health system, embed rare disease diagnosis and care into primary care, UHC and essential services. The other one could be cross-border expertise sharing. The other one, data and registries to guide policy and research. It could be also one priorities on trained healthcare professional in identification and management of rare diseases. And also the equity lens, it would be a specific focus on low and middle income country and underserved population to reduce diagnosis and care and gaps. But again, this is just indication, nothing is set in stone. We will need to have formal consultation to be able to come with what we think are our priorities. And obviously, each region will have different priorities. Again, some members have asked us, or some organization in country often said, but if we already have a national action plan, what this bring to us? So for example, let's take the country A. Indeed, it's an high-income country with a national action plan on rare diseases. Nevertheless, there are still some challenges, still some delays in diagnosis, especially often in rural areas. Not every country have the capacity across the country. So in that case, the global action plan could enhance or improve training and awareness for primary healthcare providers. So this country could decide that among all the different action that will be in the global action plan, it would prioritize, it would focus on that specific action because it's still where it has some challenges. So it's to show that the mapping exercise as well, while we are going to develop the global action plan, will be very important. Each country, each region somehow will have to map and identify where are the challenges and which action could definitely help and be prioritized in the country, in the region. So the global action plan enhance that kind of additional effort or additional prioritization from a country. There are country B, country C. Let's take country C. It's a low middle income country with no national action plan on rare diseases. The challenge then is very limited access to rare disease treatments such as orphan drug. Then an example of impact could be that then the support for innovative funding model for rare diseases. The country could take from that global action plan that part, and then it will help to reach the other level or just progress towards the overall global action plan implementation. It's a 10 years global action plan, so nobody expects the country to have implemented everything in 1 year. But what we expect is country to decide or to plan towards the implementation. I'm almost done. So the key milestone between now, I would say, and 2028, there would be the development of the Global Action Plan and in consultation, as I mentioned. In 2028, in May, again, the World Health Assembly will have to adopt that Global Action Plan. And it's a member state driven. So your engagement of your country will be very important still. And then there will be regular reports every 2 years presented to the World Health Assembly. And this is what is important because this is what creates an accountability and monitoring process, a monitoring and accountability process. This is what makes the main difference between a resolution that would have had only some action that member states should do. Having a global action plan creates target, indicator, monitoring, and accountability. Just to recap, this year, historical global commitments, rare disease are recognized as a global health priority. It's on the agenda, and now the member states, so your countries, will have to ensure that they make it a national public health priority. It recognizes the need for early diagnosis and equitable care. It's very strong in the resolution text. It called for integration into universal health coverage so that the cost of living with rare disease is not on the burden of families and patients. And as I mentioned, it called for the development. No, it's not. Yeah, it's mandate WHO to develop a 10 years global action plan. And so now it's about the implementation. And then about the significance of the regional and national action plan, I just explained what it could do. But most important, it's what next, because this implementation of the resolution, including the global action plan, will not happen without our involvement. If we only rely on the countries, on member states to make it happen, we'll again end up with a nice resolution and no actions. That's why the advocacy and notably the hackathon is very critical to push towards the impact of that resolution. And so in ADI, we will continue to engage very strongly with our different members at different levels. So you'll see at the top of that graphic, it's WHO, RDI, and the Coalition for Advocacy. I mentioned the coalition of more than 300 organizations that will still be involved. And then at the second level, but as important than the first one, you have the regional level, which is being represented at WHO level by the WHO regional offices. On the members of ADI, they are represented by our regional alliance and even our members in the different regions. And then you have the third level, which is the national level, represented by the member state and represented by national member organization of ADI or not ADI. And how we're going to make sure that those three levels work together to ensure a strong collective voice for persons living with rare disease, a cohesion across regions, an articulation of regional priorities, because we do not want a global action plan that is very top-down. We want bottom-up approach, actually. And insight then having the insights into the local reality, we have created the regional task force of ADI. And those regional task force will be in the 6 different regions of the WHO. WHO is organized in 6 different regions. So for your region, for example, it's called the CRO region, Southeast Regional Office of the WHO. It's based actually in Delhi, in India. And then there are all the other regions. So ADI works with its ADI members and its regional alliance to ensure that we have a regional task force that coordinates the work ahead of us. It means, on one hand, to be able to provide the elements that will inform the global action plan development, but most importantly, to also ensure that the main actors in the region are ready to also implement all the different actions. So each at national level, for example, there would be a need to work very closely with the Minister of Health. At the regional level, there will be a need to work very closely with the WHO regional offices. And why those regional task forces? It's because we need to coordinate our voice, not start going into different routes and silo, because otherwise we will miss the cohesion that the policymakers need. The regional task force, so who can join? So all members of ADI, obviously APADO and other ADI member organizations, the member of CARE Coalition, other representatives from NGO and health institutions that are part of the rare disease ecosystem. And we will have also industry representative. Those task forces are multi-stakeholder task force, because this is what the policymakers will need to get. So we put a QR code here, and again, those task force can definitely complement extremely well the work that is being done with the hackathon. And ADI is very committed to work with Ratna and the other members of the hackathon to make sure that we coordinate and we leverage both initiatives together. And I'm going to, voilà. So just in terms of next step, for example, we are still putting together the task force. There will be soon a webinar, notably for the Asia Pacific Task Force, that will be certainly split in two task force, one for Zero, one for Western Pacific. But the webinar will definitely present the aim of the task force and start working together.
Thank you.
Voilà. Thank you very much, Ratna.
Thank you, Alexandra, for giving the global picture and how it will translate into regional as well as national level action plans. And we'll follow that quickly with Lara's intervention on why patient-led and patient-delivered is important and how the hackathon can be a game changer for patient-led innovation, because we do know that how patients seek care and what kind of care they get is very dependent on where they live, their economic condition, the country's economic condition, and the social as well as other influences that help the person live in their own country. So over to you, Lara, on why it is important to have a patient-led hackathon.
Thanks so much, Ratna. Thank you so much for having me. It's really wonderful to be here with some brilliant minds for this exciting project. But more importantly, with people that understand that innovation in rare diseases can't just begin in a boardroom or a lab, but it needs to be in the lives of the people who live this reality every single day. And every breakthrough in rare diseases and the care begins with a story. Either a body that's not behaving as expected, a family often searching for answers, a system not quite built for us, and usually a moment where someone says, surely there must be a better way. And because that spark does not always come from institutions or industry, instead it usually comes from those directly impacted. It comes from that lived experience. And it comes from the courage to name what is missing and actually imagine something better. And that's why, for me, patient-led and patient-delivered innovation is not just a model. It should really be the direction of travel for global rare diseases work. Because when people living with rare genetic conditions co-create solutions, that's when you start to see a shift. And we move from patching gaps to actually rewriting the pathways. We can move from being consulted to actually being central, and from being the subject of the system to actually being the authors of it. And for me, this hackathon is a beautiful example of that shift becoming real. Firstly, I think it elevates the voice of lived experience from participant to architect. It acknowledges something we've been saying for years, which is expertise does not only sit with clinicians, researchers, policymakers, but it should and also sits in the long journeys of those living with the conditions and their caregivers. And when those voices are invited, not as tokens, but actually as equal partners, that's when everything changes. Challenges become clearer, solutions become more grounded, and innovation becomes something that can actually be used by the people it's meant to serve. I think, secondly, this event breaks the myth that innovation must be technical to be meaningful. Yes, there's going to be prototypes, digital tools, AI solutions, but the real innovation comes from perspective. It comes from someone saying, I waited 10 years for a diagnosis, and here's what would have helped me. And it comes from a caregiver saying, here is the daily reality nobody else sees. And it comes from the communities across Asia, across the world, each with their own cultural context and barriers, saying, if you involve us, we can help you solve this together. And that, to me, is the heartbeat of this hackathon, not just creativity, but belonging and ownership and shared partnership and purpose. And I think that is what I want to see more and more of. I think, thirdly, this hackathon bridges something we've struggled with globally, that distance between intention and implementation. Like many ideas, they sit on slides, and many strategies never actually reach the people they're designed for. But when lived experience leads the thinking and then helps shape the priorities, the ideas that emerge are not theoretical, they're urgent, they're practical, and they're designed for impact because they originate from the people whose lives actually depend on it. And fourthly, and this to me is really important, this hackathon creates an ecosystem. Innovation doesn't thrive in isolation. It needs mentorship and policy aligned, like technical expertise, partnership, and that visibility. And it needs people who believe in the idea and then people who can build it. And this event brings all of those pieces together. Patients, clinicians, developers, public health leaders, students, makers, thinkers, dreamers, countries coming together in one collective vision. And that in itself is game-changing. Rare diseases have always been scattered stories across continents. And events like these weave those stories into a movement. And finally, patient-led innovation is not only about designing solutions, it's about shifting power. It's about recognizing that the people most affected by rare diseases are the ones most invested in building a better future. So when we share that ownership, we share accountability. And where we share voice, we share leadership. And when we allow lived experience to be embedded, I think that's when we can unlock something extraordinary. We unlock solutions that honor humanity as much as technology. And we unlock systems shaped not only by data, but by dignity. So what could success look like for this hackathon? I think it could be a student in Nepal building a tool shaped by a mother in the Philippines. It could be a policymaker in India hearing a story from Malaysia and realizing a policy must change. It could be innovators in Vietnam and Thailand crafting something together that never would have existed if borders and silos had stayed in the way. It could be a person somewhere in the region feeling seen for the first time because their story inspired an idea that then becomes a prototype, that then becomes a pilot, that then becomes a new standard of care. And this is why this matters, because for people living with rare diseases, every improvement is not a small win. It could be life-changing. It could be access to diagnosis, access to information, access to coordinated care, but also access to hope. I would never underestimate the power of lived experience. Our contribution is not just personal, it can be strategic, it's purposeful, and it can be a force for innovation. And when that voice is given space, resources, and collaboration, that's when it becomes unstoppable. So for me, this hackathon is more than an event. It's a declaration that the future of rare disease innovation will be patient-led and patient-delivered. And together, through efforts like this, we can make that future real. So thank you very much for pulling all of this together.
Thank you, Lara. That's a very, very powerful statement that you just made. And I'm so glad that, you believe in what we started off as an experiment. We really didn't know where it would take us. But when leaders like you support this kind of initiatives, it really gives us a lot of hope and inspiration. So thank you so much for your thoughts. And I'll move now to guest speaker. Welcome, Eric, and for joining us on this call. And I can also see Dr. Charan. So welcome, Dr. Charan. Eric will
Thank
be
you.
speaking about the hackathon as a bold and innovative strategy led by patient groups. And I would like to acknowledge the fact that the whole idea was seeded in a workshop that was led by Sanofi for building capacities of patient groups across the Asia region. And just a chance remark from one of their leadership built us into this idea. And that's how we have sort of worked on this whole hackathon, initiative for the last 3-4 months. And we are here today at the launch. So thank you so much, Eric, and your team for that leadership. And I hand over the space to you for your thoughts.
Thank you very much. Hello, everyone. Well, thank you for joining this Rare Impact 2025 hackathon. Well, I'd like to start with a thank you as well, Dr. Ratna, to you and your team at the Rare Rich Initiative at Dakshama Health and the Pear Academy. I think what you have built here is really something special. And I can tell you, Sanofi, myself and the team, we are very excited to be part of it. Also, I'll take the opportunity to extend a warm welcome and thank you to Alexandra Humber from RDI, Dr. Bhagwan Singh Charan from MOH, and Monica Fire from Apardo. And of course, to all the participants. Your presence today really underscores the importance of collaboration. Collaboration in advancing rare disease care and also support across the whole region in Asia Pacific. I'm really, really glad to have together coming patients, caregivers, developers, clinicians. We have industry partners, and we're going to work together with a shared goal. When you look at the healthcare innovation, for many, many years, this innovation for all therapeutic areas has been very top-down and mostly driven by academia, experts, specialists, clinicians, and industry. And this approach, we have to acknowledge, brought important advances. But very often, it's missing something essential, which is the real experience and the experiences of those who aim to help the patients. Today, I think something is changing. We see a change in motion with both patients and caregivers who are no longer just receiving the cares, but they are leading and creating solutions and change, which is, I believe, a very necessary step for progress, especially for rare disease. In the recent years, all over the world, and I think it's particularly true in Asia, we've seen patient groups changing greatly. They more and more express needs that are based on real experiences of patient and caregiver. And they bring together experts from many fields. They are the catalyst in changing innovation based on empathy. So I believe that this Rare Impact hackathon is different from what we call the traditional approaches. And this for three main reasons. First, as I said, we are focusing on the most important problems, which are the needs identified through real experience. In rare disease, patients often face years of wrong diagnoses. They face limited treatment options. They feel alone for many, many, many years. So who better to identify the challenges than those who are facing them? Second, these events are bringing different sectors together. Rare disease is complex, and we need solutions from many different experts. So I'm confident that by bringing our collective intelligence together, we are going to amplify our impact. Third, and we really need that, is speed. Hackathons are quickly turning ideas into action, into tools, into applications, processes, and so on and so forth. While other activities might take years, we have the ambition to turn our ideas in action in a matter of days. And this is exactly what we need for the rare disease community. Now, a few words about Asia. Healthcare is changing very quickly in our region. And we have unique challenges. Of course, the geographies, the distance between the countries, the fact that the healthcare systems are very different from one country to the other, different maturity. The priorities are not always very aligned. We have, of course, more generally, a lot of difference in cultural differences, let's say, varying economic situation and so on. But I truly believe that all these challenges and differences are also creating some opportunities for us. We are probably the region where digitalization is growing the fastest. And we see the emergence of what we will call health tech entrepreneurs who are here to support and bring solutions. And most importantly, we see patient community becoming more and more organized, more and more empowered. And this is really creating the perfect ecosystem or perfect setting for developing solution that will not be only technical, but also culturally appropriate and accessible in our region and culture. At Sanofi, we really believe that healthcare solution must be created with patients, not just for them. And that's particularly true in rare disease. If we want to help build an ecosystem that responds to the patient needs, it's not about what we think they need. It can only happen through the real partnership with patients. So for that, we are focusing on 4 key pillars. First, we listen. So we have implemented patient advisory board for all different treatment areas. And what we've created is a kind of patient journey map in order to understand how patients are struggling throughout their healthcare experience. Second, we've changed our research and clinical trial processes. We've been including patients throughout the whole clinical process in order to ensure that we're creating solutions that address real needs throughout the clinical process. Third, we are working on access and making sure that patients can get the solution we develop. It's not enough just to develop digital health solutions, support program, etc., but we need to make sure that we're able to reach the patient eventually. And fourth, we are looking beyond traditional clinical measures. I can mention one example. For example, in Singapore, we've started to work on a sustainability project in order to reduce the carbon footprint of patients compared to current standards. And we are proud to lead this area because it's recognizing the full social and environmental value of healthcare. And that will become increasingly important. So we are changing how we view patients, not as a subject, but as a partner. And this is probably the most important change that any healthcare organization or stakeholder can make. So as we start this hackathon, I really want to emphasize that Sanofi is honored to partner with all of you. The challenges of rare disease are very complex, so it cannot be solved by one person and one organization, that really require collaboration. And the solution we are going to develop together will probably start at ideas, then translated to prototypes, etc., but really eventually can transform lives. So by focusing on the patient voice, by removing barriers between the stakeholders, and by applying technologies, we are really creating the future of rare disease care. So together we can create a future where rare doesn't mean forgotten, and where innovation serves real human needs. So I really look forward to the amazing innovation that will come from this collaboration, from your wisdom and creativity. So thank you very much.
Thank you, Eric. So treating patients as partners, that's one of the most powerful statements I've heard today, not just as beneficiaries to innovation, but co-creating innovation and leading the way through lived experience. So thank you for that opportunity. And now it is my pleasure to invite our keynote speaker, Dr. B.S. Charan, the Assistant Director General at the Director General of Health Services, Ministry of Health, Government of India. And he has several hats that he wears, but one of the most important ones is that he's the member secretary of the National Rare Disease Committee, NRDC, and a member of the Central Technical Committee for Rare Diseases. He's been involved in the whole growth trajectory of how the national policy for rare diseases was shaped in India. India is one of those few countries that actually has a national policy with a dedicated fund for treating rare diseases. And we have 63 rare diseases that are already included in the policy. We have also been one of those few countries that has used technology to advantage, whether it was during COVID or for mental health services or for telehealth and telemedicine. So over to you, sir, to hear from you how India can leverage the advantages that it already has to serve the patients with rare diseases. Thank you, sir.
Thank you, Ratnaji. Before starting, can you confirm, am I audible?
Yes, we can hear you.
Okay, thank you very much. So first of all, I would like to congratulate and thank you, Ratna Devi ji, for inviting me, giving me this opportunity to speak among the esteemed guests, and many best wishes and Thank you for this hackathon launch. So I'll be restricted to my time slot and very brief. So as you correctly mentioned that now at least the India has formally launched this national policy for rare diseases uh, since 2021. So it's we are taking a baby step. It's just 4 years back we officially launched, and now we are having some document to care about the rare disease patient. So in this NPRD, India has comprehensively incorporated all the component which holistically, we can to take care of the rare disease patient. It includes not only the diagnostic part, but also the, some financial assistance in the form of giving them some amount is provisioned. Then we have our registry system to know the prevalence. Then we have Center of Excellences designated tertiary care institute where we can make the diagnosis and patient management part. In addition to that, we are uh, resources are always scarce, so we have some mechanism that mentioned in the NPRD to for resource pooling so that we can fulfill the this exorbitant cost of the rare disease patient. So beginning with that, I will focus today mostly the part of the digital aspect of health. As we know that data is the main source if we want to build our policy on the scientifically evidence-based policy, and we want to make or change the policy, we need the data. Based on that, if our policy is directed, then the result will be better. So India has long been this insisted one system of Aadhaar based UPI payment system, and it's leading the world. So it's a you must have seen in the India that everyone is having the smartphone, and nowadays even the very poor people, maybe it's a vegetable vendor or auto rickshaw driver, they have some QR code, and through UPI you can make the payment. Nobody is having a cash form of the money in India. So that we can leverage in the health system also. And for that matter, we in India there are some health initiative where we started this digital transformation for the betterment of the patient also. One distinctive example is the telemedicine, where in the remote areas, if patient is not accessible to the tertiary care institute or expert advice, then through this digital channel, through this online system, they can approach in a remote area to a tertiary care institute or to the expert, and they can get the services of the expert. So this is a very good example of how we can leverage on the digital aspect for the betterment of the patient care. Similarly, this can be reciprocated for the rare disease patient also. Now we are having only center of excellences for diagnosis and patient management, but in the future we have a plan to give the most more accessibility to the patient, and we will create a hub and spoke model so that through spoke we will reach nearer to the patient, and then we can incorporate these digital methods for the last mile patient who is at a very remote place, very difficult to for the this transport point of view. So, and the particular some of the groups in rare disease where ambulation movement is very difficult. So this kind of innovation may be very useful. So we are working on that, and we have a thought that our existing system has shown that we can do this, and for that I think we have a thought for that. Coming to knowing the exact prevalence of the disease, we have one ICMR operated rare disease patient registry. It's all online system. Through digitally, we can make the parameter which all are registered in our not only our center of excellences, but also the other government or private institution, where if we see any rare disease patient, they can report it to us, and we will have a database. So again, this will be one area where to know exact prevalence disease wise, area wise, that system can work, and that will be very helpful to know the exact patient load in our country. So these are some of the examples among many others. Now the assistance part is all through in a digital form, and in research collaboration and some genomic databases, there is a, it's a very in an advanced stage in India, where we are promoting, not only promoting, but we are making a genome database. So that digital health component is very crucial and very progressive. So I think, as I mentioned, now the all work in the right from the offices to the patient care is shifting from as far as possible manual to the digital. So in the coming areas, the use of AI based devices, or from accessibility point of view, this will be a very useful tool in our NPRD 2021 also. So I think, in some of the aspect, India has shown the proven effectiveness and use of these digital tools. Some of I have mentioned, some we are working, and I congratulate and thank you, Ratnaji, that we would also like to have the some of the learning lessons from our other stakeholders, that esteemed speakers. If they have any suggestions, their learning lessons, their success stories, surely we will incorporate in our NPRD 2021. So with that, I think I stop now. Thank you very much.
Thank you, sir. Thank you for your thoughts and for all those interventions that have already been thought through by the government and will bring a lot of hope to the patients in India. Thank you for your intervention. With that, I will move to Monica, who will talk about collaborations, and Alexandra as well as Eric both mentioned and referred to why it is important to have collaborations. Lara, you mentioned why lived experience has to be the front leading this collaboration. And Monica, as the executive director of the Asia Pacific Alliance of Rare Disease Organizations, is doing exactly that, bringing organizations, patients, clinicians, etc., together to find solutions that are appropriate for the region. So over to you on why collaborations are important and how APARDO can make this a reality.
Thank you so much, Ratna. It is just so wonderful to be here and to be part of these presentations, because I think they have laid an amazing foundation for how we intend to go forward. So the fact that we're doing it together is a super example, as was just said, about the power of collaboration, but the intention of collaboration and the purposefulness about collaboration. And I just want to say thank you, Ratna, to you and your team for having the insight and appetite to grab hold of an idea, which is so often the way things happen, in an informal passing moment, and to say, let's actually make this a reality, and let's bring people together that can make this a reality. So thank you and congratulations for bringing this together. I also want to say thank you to the speakers who laid such a great foundation, as I said, and just some words that I want to repeat. And we've heard patients as partners, patients leading the thinking and shaping the action. I love that, Lara. I will use that. I hope that's okay. But I think that is exactly where we need to be and where we should be and where we can make the most difference, leading the thinking and then shaping the action. Honoring humanity, I think, is an incredible concept that we keep front and center ourselves and spend a lot of time asking that the people that are in our worlds honor our humanity. And it's time to be in a position where we don't have to say that anymore. That's the value that everybody brings to working together and working with people with lived experience in rare disease. So I think that's super, super important. The Asia Pacific region is such an exciting place to be. And I think that the opportunities that exist for us as a region have really developed and changed over the last 5 years. We've seen a real shift to both an appetite within the region to change the lives of people living with rare conditions. But I think we've also seen a recognition outside the region that says Asia Pacific can make some amazing changes, because it is a region with the potential to collaborate very effectively at all the levels that matter. So from our community, from our clinicians, from our industry, there is a recognition that, you know what, we can actually work together, and together we can make that difference. And thank you, Ratna, for introducing and talking about Aparto and the role that we play in that. And we are actively working to bring together those networks, to bring together that commitment to how we make collaborative change. And one of the things that we know about collaborative change and implementation has been mentioned a couple of times, is that implementation actually doesn't mean that we need to do more of things. And that's why this hackathon is so important, because we often think about that to make change, we need to do more. And we don't. We need to do different. If we needed to do more, change would have been made forever ago, because that's what the community's been doing for forever. We've been working harder. We've been trying to talk louder, but it's not about that. It's about how do we do it differently. And this hackathon absolutely provides the opportunity to make that happen. And that's what's so exciting about it. This is the leading the thinking and shaping the action, and providing a structure through the hackathon to be able to do that, which I think is terrific. The hackathon will mobilize cross-border collaboration and expertise. So this isn't about what we can do in our own country, but recognizing that countries bring different perspectives, different expertise, different challenges. And it's not about saying, well, how do we actually bring everyone together and put them on the same page to solve this very large problem. It's about how do we listen to all of the different voices and use those voices brought together to make some change. And as you said, Lara, a small change can be a really big change, but we need to begin, on that journey. So we can share resources across our borders, and those resources can be our thinking. Those resources can be material resources. Those resources can be things that we've developed. Those resources can be experiences of community coming together. That diversity of lived experience, both lived experience as people utilizing the health system, because I think we often think about finding innovative solutions that are about the health system, but our lives are so much more than what we need from the health system. And that's another reason why this is a really important initiative. The hackathon is because it can explore way outside the health system. How do we improve quality of life? Well, the health system is just part of that. So that's exciting, because it means that there is a broad area that the hackathon can think about and develop those prototype solutions that can then be transferable. They can be scalable. We're not looking for, here's a solution that can solve every problem everywhere, because we know that that's not possible. And Alex talked about how it's so important in the global action plan is not, here is something that can be done, and so everyone has to do it. It's a choose your own adventure scenario that each of our countries, but us as a region, can support through the hackathon to say, all right, let's begin this in this way, and then determine how we scale, how we build. And I'm sure you find this as well, but sometimes when people who don't bring that lived experience bring a solution, It's actually a solution to a problem we actually don't have. It's a solution to a problem that they know how to solve and they think would be good, but it's actually not one that's on our list of things that we need solved. So that's another reason why building from the ground up in the way that the hackathon does is so critically important. There's a number of things that will be shared as part of the hackathon journey across the region, and why collaboration is again at the heart of how we go forward. So sharing those problem statements, sharing what are those things that we know need our shaping, our thinking, our perspective, our energy and effort to bring together to find those solutions. And teams from different countries will bring their own experience to that. Shared mentorship. So I pay tribute to all of the brainpower, and not just brainpower, all of the gifts and talents that everybody in this meeting brings, because it takes a village, but it takes all of the personalities and all of the capacity and capabilities within that village to actually be able to develop something that then becomes meaningful. And each of us will learn from one another throughout this journey. And we will find fellow travelers, but we will also find people who inspire us, and people who, through what they've already achieved or their innovative ideas, that challenge and make us better at what we're doing locally, but also what we're doing together. The ability to determine shared outcomes and shape those outcomes based on what's important to us, I think is always really an important part of a collaborative experience. But this experience is going to deliver. So this hackathon is going to deliver. So those outcomes will be implementable, deliverable activities. So getting those on the table, getting those shared, and getting shared accountability for those is going to be an important part of this journey as well. And the ability to look for shared investment. And that when we talk about shared investment, we all go the first place, that's about money. And well, yes, it is about money, but it's more than money. We need all kinds of investment. We need all of the people on this call to invest themselves in the idea of the process. We need everyone on this call to invest in each other and supporting each other. And we all bring that because that's what we do, but it's going to be an important part of underpinning how we take our collaborative hackathon spirit forward. A hackathon by nature needs diversity and is going to be driven by diversity. And that's what we've got. So we're already in a position to be able to say, yeah, we can take this on. We're ready to take this on. And collectively, we know that our diversity actually multiplies and creates our collective strength. So super thrilled to be part of this team and moving from the isolated efforts that sometimes we see to that collective action. So Ratna, thank you, and back to you.
Thank you. As you said, that the hackathons are usually tech people who are working on problems and solutions. What is unique about this is that the tech is just a supporting role. The main role is by the patients, caregivers, and families, and they are the ones who are bringing the clinicians, the mentors, the policymakers, and everybody else in the ecosystem to work with them to find a solution. And I really hope that these solutions are scalable, implementable, and will find the necessary investments, as you said, the shared investments to be able to scale them up. I'd I'd just like to end by saying that in India, we've had a very, very supportive ecosystem for innovation. We have something like the Invest India and the Startup India. We have more than 10,000 startups in India, a lot of them in health and health tech that have really shown how small ideas can be scaled up for something that is very disruptive, somebody who would never have thought of such a solution, especially in cancer, early diagnosis for cancers, early diagnosis for heart attacks, things which are non-invasive and still using disruptive technology to be able to arrive at diagnosis years before the actual incident happens. We also have a very thriving startup ecosystem in Singapore, in the Asia region. So I'm hoping that some of these solutions that will come up will find the investors to take it forward. And I will definitely not be able to do this alone. I need the support of all the eminent speakers and the organizational representatives that are there in this room. We will do this together. We will take the journey together. And a big thank you, sir, Dr. Charan. I've been very fortunate to have worked with him for more than a decade, a very supportive, very visionary person. And it's because of leaders like him that patient organizations like mine thrive in this country. We always get the support and a very helpful ear whenever we go to them with our problems. Given the diversity and the enormity of our country, things are a little difficult to achieve. If it's a small country, it's easy. We are 1.4 billion, so all programs are also magnified to that extent. But in spite of that, we always have a listening ear from our policymakers. So thank you so much. And with that, I will conclude today's session. I think we had a virtual ribbon cutting ceremony. Vikas, if you are ready, then please let us do that. There you go. So it is officially launched, and I hope all of us can stay together over the next 3 months or about 65, 70 days, and look forward to seeing all of you in India next year, hopefully when we have our in-person meeting. So thank you, everyone, and let's stay together and work on this together. Thank you once again. Thank you.
Thank you, Ratnaji.
Bye.
Thank you. Thank
Thank
you.
you.
Thank you so much, Ratna. Bye.
Thank you.